It's actually not possible to get COVID-19 from any of these vaccines because they are not using live virus.
Short-term side effects that were observed in the leading COVID-19 vaccine trials included injection site pain and redness, fatigue, muscle aches and pains, joint pain, and headache.
When one develops these short-term symptoms after receiving the vaccine, that in fact is a sign that the vaccine is working and that your body is marshaling its defense network.
It's important to note that none of these vaccines can give you COVID-19 since they only express a protein from the virus that allows your body's immune system to generate antibodies.
And so it begins. The road back to the way things used to be here in Ohio. The vaccine we've all been waiting for has finally arrived.
It's safe.
It's tested.
And it works.
Right now, we're rolling it out to Ohio's most vulnerable seniors. But our journey's just beginning, and we need your help.
By continuing to social distance and wear a mask.
Until we're all protected and back to the way we remember.
The world is waiting. It's waiting for new ideas, waiting for new solutions, waiting for the next big breakthrough. But scientific discovery takes time, you say. So many possibilities to explore and countless dead ends. If only we could get there faster, which is exactly why CAS is here. Specialists in scientific information. We extract and analyze the world's scientific data so you can build upon the right discoveries. We provide the insights only expert scientists can deliver, so you can leverage new approaches for faster results. And we put big data within arm's reach, so progress isn't just something to be desired, it's expected. That is why we do what we do. To ensure the innovators of the world, like you, are able to meet the greatest needs the world has been waiting for. Together, we will do great things.
Remember when we were young and our parents took us to get vaccinated? Well, now it's our turn to help them because the COVID vaccine is available for older Ohioans. The vaccines are safe, effective, and have been rigorously tested. It will take time to get people vaccinated, but it's the best way to protect our health and help Ohio on the road to recovery. Learn more at coronavirus.ohio.gov. We can all make a difference.
It's okay to feel a little anxious right now.
It's okay to be sad, lonely, or confused.
It's okay to feel angry or like you've lost control.
And it's okay to ask for help. Ohio's Careline is an emotional support hotline staffed with behavioral health professionals. It provides free confidential assistance to help navigate these uncertain times. It's okay to not be okay. With help from Ohio's Careline, there is hope.
It's actually not possible to get COVID-19 from any of these vaccines because they are not using live virus.
Short-term side effects that were observed in the leading COVID-19 vaccine trials included injection site pain and redness, fatigue, muscle aches and pains, joint pain, and headache.
When one develops these short-term symptoms after receiving the vaccine, that in fact is a sign that the vaccine is working and that your body is marshaling its defense network.
It's important to note that none of these vaccines can give you COVID-19 since they only express a protein from the virus that allows your body's immune system to generate antibodies.
The world is waiting. It's waiting for new ideas, waiting for new solutions, waiting for the next big breakthrough. But scientific discovery takes time, you say. So many possibilities to explore and countless dead ends. If only we could get there faster, which is exactly why CAS is here. Specialists in scientific information. We extract and analyze the world's scientific data so you can build upon the right discoveries. We provide the insights only expert scientists can deliver, so you can leverage new approaches for faster results. And we put big data within arm's reach, so progress isn't just something to be desired, it's expected. That is why we do what we do. To ensure the innovators of the world, like you, are able to meet the greatest needs the world has been waiting for. Together,
it's okay to feel a little anxious right now.
It's okay to be sad, lonely, or confused.
It's okay to feel angry or like you've lost control.
And it's okay to ask for help. Ohio's Careline is an emotional support hotline staffed with behavioral health professionals. It provides free confidential assistance to help navigate these uncertain times. It's okay to not be okay. With help from Ohio's Careline, there is hope.
And so it begins. The road back to the way things used to be here in Ohio. The vaccine we've all been waiting for has finally arrived.
It's safe.
It's tested.
And it works.
Right now, we're rolling it out to Ohio's most vulnerable seniors. But our journey's just beginning, and we need your help.
By continuing to social distance and wear a mask
Until we're all protected and back to the way we remember.
The world is waiting. It's waiting for new ideas, waiting for new solutions, waiting for the next big breakthrough. But scientific discovery takes time, you say. So many possibilities to explore and countless dead ends. If only we could get there faster, which is exactly why CAS is here. Specialists in scientific information. We extract and analyze the world's scientific data so you can build upon the right discoveries. We provide the insights only expert scientists can deliver, so you can leverage new approaches for faster results. And we put big data within arm's reach, so progress isn't just something to be desired, it's expected. That is why we do what we do. To ensure the innovators of the world, like you, are able to meet the greatest needs the world has been waiting for. Together, we will do great things.
There are a lot of questions right now. Questions about our new normal, about how to unite a country divided and find equality for all. Tough questions, but here in Ohio, we've always been pretty good with answers. It's 1903. The whole world is asking, is it possible to fly? Ohio says, we've got two brothers we'd like you to meet. In '69, our country asked, who will take one small step for us? We've got the man for that. How do you make machines that move us? Machines we cheer for. How do you start a movement, make peace, honor rock and roll, come back down 3-1? How do we recover from a global pandemic unlike anything we've ever seen before? Ask Ohio. We'll show you.
It's actually not possible to get
Good evening and welcome to Ohio's Rural Town Hall Meeting. I'm Wally Burden. I'm the Senior Local Liaison with the Ohio Department of Health. We want to thank you for your attendance and say how pleased we are to have you with us this evening. These meetings are important to help get the message out about vaccines, their availability, and the important work being done to protect our citizens against the COVID-19 virus. We have 3 vaccines available in Ohio: Pfizer, Moderna, and this week, the newly approved Johnson & Johnson vaccine. We have several expert panelists with us this evening. We have medical leaders, community and faith leaders, and a couple of health commissioners from our rural communities with us. These panelists have been assembled to provide information and answers to the many questions that we're garnering from our communities across the state. This is the 4th in a series of 4 town hall meetings provided by our sponsors. Let's take a moment to thank our sponsors: CAS, the Ohio Department of Health, the Ohio Department of Mental Health and Addiction Service, the Ohio Latino Affairs Commission, the Governor's Office of Faith-Based and Community Initiatives, and the Appalachia Ohio Commission. Before we get started with our panelists and our questions, I have the distinct pleasure to introduce our governor, Mike DeWine, for some opening comments. Governor DeWine.
Wally, thank you very much. Thanks everybody for joining us tonight. As Wally said, this is the 4th town hall meeting that we've held, and they've all been very well attended, and I think have worked out exceedingly well. You know, we've been at this epidemic for a year. It's hard to believe. It's almost now a year since our first case was found in Ohio. But the good news is we now have the ability to be on offense, and we are on offense. We have the vaccine. In fact, we have 3 vaccines now, and they're coming into Ohio at the first time really at a great rate. So this week, Monday, Tuesday, Wednesday, and Thursday, we will be receiving almost 450,000 doses of the first vaccine for the first shot of the 2 shots. And that's just very, very exciting for us to be on offense, to be going after this virus. 1 2/3 million Ohioans have already received their first shot, and many have received by now their second shot. And of course, we now have a vaccine that's only 1 shot, which is also very, very exciting. So people this week can go to their pharmacies, whether it's a chain pharmacy or their local pharmacy, their local health department. The health departments, you have several of the commissioners on. They've been doing an absolutely phenomenal job. Also the hospitals, as well as our federal health clinics around the state of Ohio. So all told, 1,205 separate locations that people can get the vaccine. But tonight is about learning about the vaccine. And I'm not the expert. You're going to hear from the experts in a minute. But I think it's understandable that some people are just questioning. They have questions. And the whole purpose of putting this town hall meeting tonight is to take some of your questions and to be able for the experts to give answers to this. For Fran and for me, we've been able to get the second shot. We just got the second shot about a week ago, actually a week ago today. And for us, it gives us the opportunity to start getting back to normal, to see our grandkids more, to see them up closer than we have been in the past. When summer gets here, to see go see baseball games, whatever you like to do, whatever's important in your life, this vaccine gives you the ability to start doing that again. So it really is our ticket to freedom. It's our ticket back. And when enough of us get the vaccine, we'll be able to drive this virus into the ground. And that's certainly what we've been waiting for. So thank you all very, very, very much for being on here. And Wally, I'll turn it back to you. And thank you for being the MC tonight. And I looked at all the panelists. We just want to thank each and every one of them. They're people who really understand the vaccine, who understand these issues. And I think you're going to have a very informative next few minutes. Thank you very much.
Thank you, Governor DeWine, for your opening comments. Let's move directly to our first question. Our first question this evening is, what is in the COVID-19 vaccine? How was it developed so fast? And why is there more than one kind? We're going to move to our medical leader panelist. First off, we have Dr. Kevin Sherritt. He's a family medicine doctor and director of the Rural Health Services for the Kettering Health Network. He's also a farm operator. We also have with us Dr. Matt Anderson, assistant professor in the Department of Microbiology and the Department of Microbial Infection and Immunity with The Ohio State University. Dr. Sherritt, let's begin with you.
Well, certainly when we talk about the vaccine and how it was developed and what a vaccine is, I think it helps just to initially recognize what a vaccine does. A vaccine is a substance or a treatment that's administered to a patient to produce an immune response. That immune response then protects the patient from that particular illness or disease that the vaccine is designed for. And so the vaccines that we have now have been specifically designed to protect the individual from the COVID-19 virus. And so, you know, the old saying is there's more than one way to skin a cat. There is more than one way to produce a vaccine. And so this technology that we see right now is a new technology for the first two vaccines. And now the Johnson & Johnson vaccine that's coming out this week is more of a traditional technology that's been utilized in vaccines over the years. So I want to pause just for a second. Dr. Matt Anderson is with us, and he's an expert in virology and vaccines. Dr. Anderson, do you want to add any more to that?
Yeah, I think you did a really good job of introducing kind of the idea behind it. The two different vaccines don't differ by very much. They're basically mimicking the virus that your body would see so that you mount that immune response to be able to combat it. And the vaccines overall are very simple ways of eliciting that immune response. So it's just a small snippet of the material from the virus, mostly coated by just some lipids, some fat molecules, to be able to get it into your body.
You know, when they talk about the development of this vaccine and how rapidly it was developed, even though this is new technology in terms of being used for a vaccine, this technology has been around now for over a decade. This messenger RNA technology has been utilized for treatments of other diseases and other illnesses. And so the urgency of treating this virus really rallied our scientific community around using the latest technology to produce a vaccine that is ultimately turned out to be extremely safe and extremely effective.
Just add to what Dr. Sherritt said. This vaccine has fundamentally been in development for 30 years, even before we understood that this threat would present itself to the entire globe. People have been working on this RNA molecule-based vaccine since about the 90s. And it's really an accumulation of all that work that's got us to the point where right now the medical community was able to respond as quickly as it could because of the buildup information and all of the different trials and the public health information based on some of these initial tests to see how safe and effective this form of combating viral diseases would be. So once we understood what the virus looked like, as early as February of last year, the public health community was able to begin rallying to be able to build an effective strategy to be able to combat it through this RNA-based platform, this mimic of what the virus would look like. And so you may be asking yourself, well, why are there so many different types of the vaccine? And that really goes to the fact that, as with everything, different companies were competing with each other to try and produce this safe and effective way of combating the virus as quickly as possible. And so multiple companies, about 5 or 6 companies, all put in applications to begin building this vaccine from day one. What I think is kind of a testament to the process of tracking how effective and safe the virus is the fact that not all of those are available. Really, the ones that have been vetted well to show that safety and efficacy is there are the ones that we're seeing being delivered here in the state of Ohio right now.
You know, and a question I get asked every day in the office is that, you know, how was this done so quickly? And there must have been shortcuts. There must have been steps skipped or missed or jumped over. But the reality is there were no shortcuts in developing these vaccines. The bar was not lowered in any way for these vaccines to get approved sooner. The steps were achieved one by one, and there was no compromises made in making these vaccines. Is that correct?
Absolutely. If you're thinking about which vaccine makes sense or which vaccine, should I choose one over the other, I don't think you're going to be amiss by choosing any of them. There are some small differences in the design, but they all have shown that safety and efficacy, which means they all provide the protection that we're looking for with this vaccine itself.
You know, and I would add, in my career dealing with vaccines, you know, I've been vaccinating children for 30 years now and vaccinating adults, and the vaccines we have each year, there are more vaccines available for the various illnesses. There has yet been in my career a vaccine available as effective and as safe as these two vaccines. I can stand behind these two vaccines 100% in terms of their effectiveness and their safety.
Absolutely. I think the data speaks for itself. If you have a 98% protection rate and you've been able to minimize any issues with the vaccine delivery and its ability to elicit that immune response, then you really have a powerful tool that we typically don't even see as being effective in other vaccine types, even against things like flu shots every season.
Yeah, yeah. I mean, these vaccines are, in my opinion, unparalleled in their effectiveness and their safety compared to the vaccines we're used to using every day.
I think it's also important to state the fact that the vaccine wasn't being distributed to the public from the very get-go. There are a number of steps that these companies had to walk through that are intended specifically to ensure the safety of the medicine before it reaches the general public. All of those lines were met the way that they are supposed to by the companies in concert with the medical and the public health community. So all of the standard steps that have been taken for every medication that's delivered to people in this country were met by the companies in production of this vaccine.
Thank you, Dr. Anderson and Dr. Sherritt, for your comments. Let's move to our next question. What is the best source of information on the science of COVID-19 and the vaccine? And how can I tell if the information I'm getting about the vaccine is accurate? I'd like to introduce our community leader panelists and our faith leader panelist. We have Dr. William Hablitzel with us. He's an internal medicine doctor. He serves as the Adams County Health Commissioner and their medical director. We also have Al Landis with us. He's the Tuscarawas County Commissioner and a former state representative. And we have Reverend Ashley Steele. She's the executive director of the Urban Mission Ministries in Steubenville, Ohio. Dr. Hablitzel, let's start with you.
There's an abundance of information available, and sometimes that's confusing. There's so much information. Of course, we almost all now turn to the internet for information, and the sites that are the best is a personal decision for everyone. You can't do better with the site that Ohio has established, the coronavirus.ohio.gov, and the CDC site, coronavirus.gov. On these sites, there's an abundance of information, not only about the vaccine, but about the disease itself. And there's many links to manufacturers of vaccines and to other sources of information. There's so much information, sometimes you're not sure what's accurate and what's not. And if you go to a reputable site, one that's, I think, sponsored by a a government agency or a university or a medical association, usually that's a pretty good indication that they've had experts reviewing information before it's posted. So I think those sites, and you can't forget that when you're reading information, if you're not sure about it, you have questions, perhaps the most invaluable source of information is your personal medical provider. If you have a question, ask them.
Thank you, Dr. Hablitz. So let's move to County Commissioner Landis.
Well, thank you, and thank you for the opportunity to be part of this this panel. And again, it was well stated by Mr. Habitzel that there's so much information out there, and you have to sort through it. In that same way that you get any news, you have to look at the source. Who is putting the information out? Where does it come from? And we had a very good system here in place in Tuscarawas County. We have a meeting previously every Tuesday with our emergency management agency, and that included our Tuscarawas County Health Department, our New Philadelphia City Health Department, medical professionals, and hospital. Our local hospitals participated, and that was where most of the information that I got, where you could verify that this is what the actual facts are. This is what the science is. And so, we're very fortunate there that, we've got websites out there, again, including the Tuscarawas County Health Department, the New Philadelphia City Health Department, the Ohio Department of Health. But going back to it, it came right down with me and the decision that my wife and I made to get the vaccine, and we were vaccinated on February the 12th, is I talked to my primary care physician. He was a wealth of information. He, makes sure that I was, well aware. And, I just flat out asked him, I said, "Doctor, would you get the vaccine?" And he said, yes, I would. And I said, "Should I get it?" And he said, "Absolutely." So again, I tried to verify the source and depend on the medical experts, not everything that you see floating around on the internet.
Thank you, Commissioner. Now let's move to Reverend Ashley Steele. Ashley?
Well, good evening. Thank you, Wally. Thank you for the opportunity to be on this panel. For the staff and I at the Urban Mission, we have made it a priority to obtain information from direct sources. The coronavirus.ohio.gov website has been helpful and full of information for us. The Centers for Disease Control website has a wealth of knowledge. And our local health department has played a key role in giving us reliable and relatable information to help us communicate to the communities that we serve. We know people have their hesitations. This has been a difficult time to sift through a lot of information. And now, as people make the decision as to whether they will get the vaccine or not, it has been important for our ministry to communicate a clear and consistent message that the vaccine is safe, that it is effective, and that it is free. We communicate using a monthly newsletter as well as social media. We have a lot of one-on-one conversations. We seek to share as much information as we can, or at least direct people to a direct source. We do receive a lot of our information through sources like websites, and this information is easily accessible to us because we have the internet. If somebody doesn't have the internet, we have directed them to other places, that there are locations in their neighborhoods, in their communities, in their towns, like libraries and hospitals, their doctor's offices, free health clinics, agencies, churches, and even organizations like ours, that they can obtain this information as well. I have always believed that when people have access to information that is timely, that's relevant, and that's accurate, they have no problem making a decision on their own. People are smart, people are wise, but they deserve accurate information, and that's something that we've sought to do. Like many of you on the panel, we have taken an oath, or in my case, a vow, to be good stewards in our community and to be caretakers, to care for those we serve and to make sure that nobody is taken advantage of. And one way we can do that is to be a good steward of information that we're providing to them.
Thank you for your comments. Let's move to our next question. Are there home remedies that can prevent me from getting COVID or that can take the place of a vaccine? I think this is particularly important in a rural town hall because most of our rural folks are used to home remedies and those types of things. Let's bring back our medical leaders, Dr. Anderson and Dr. Sherritt. Dr. Anderson?
Yeah, in the case here, there's really no good home remedy for preventing the virus. I mean, fundamentally outside of washing your hands. So soap and water is probably your best defense against the virus in this kind of setting. Any home remedy that you would take isn't going to be able to necessarily take the place of a vaccine because it's not going to be able to provide protection to your system from something it hasn't seen before. So this virus is new to people and your body doesn't know what it's looking for. And so any home remedy isn't going to be able to deal with something that's completely new. Any home remedy is simply going to treat the symptoms and not the actual virus itself. There are ways to reduce fever, sure, but it's not going to take the place of the vaccine to prevent the infection. Dr. Sharp?
Yeah, you're exactly right. I mean, the short answer to that question is no. There is no home remedy that is going to protect you from this virus. As Dr. Anderson just said, this is a novel virus. It's new. Our bodies we have not seen this virus before. We have zero immunity to this virus. And, you know, I explain to patients every day, if you're exposed to this virus for a significant exposure, you will get the COVID. You have no defense. You will get it. Fortunately, a lot of individuals do fairly well. Unfortunately, a lot of individuals don't. And we can't predict how someone's going to respond to this virus. So there is no home remedy. The only defense that we have against this virus is the vaccine. There are treatments, and we're seeing some improved treatments, but prevention, an ounce of prevention is worth a pound of cure. And the only way you're going to prevent yourself from getting this virus is to get vaccinated. And in fact, if you don't get vaccinated, you need to assume that sooner or later you will contract this virus.
Thank you for your comments, gentlemen. Let's move to our next question. What are some of the benefits of taking the vaccine? Why should I consider taking it? Dr. Steele, Reverend Steele, we'll begin with you.
Thank you. I must say, as I reflect on this past year, I am reminded time after time how dramatically life changed for so many people. There is not one person that hasn't been impacted by the effects of COVID-19. For example, at the Urban Mission, the number of families we typically serve through a food pantry tripled in number last year. That means that families who never visited a food pantry in their life had to reach out to us for support. Our shelters also saw an increase in the number of people needing emergency housing, people looking for a safe and welcoming environment, a place of refuge during this time. Personally, I've loved ones, friends who have suffered the effects, the physical effects of COVID, some even losing their lives. And when you live in a small town, when you serve in a small town, one loss is significant, and we've had a number of them. As I think about the mental, emotional, spiritual strain this has had on people, it is considerable. I'm a pretty hopeful person, and I found that I needed support from time to time. My kids have been doing virtual school, and while this has been helpful for them, their teachers have been great. It's been good to keep them and others safe when we first didn't know really how things were going. What was a trying time for us is when our internet didn't work. And so that was frustrating. And I know that a lot of people have experienced that as well. As I think about the benefits of the vaccines, the first picture that comes to mind is my grandpa. At 98, almost 99 years old, he has seen a lot in his lifetime. The Great Depression, he served in the war, and he often shares that this time has been one of the toughest times for him. And so to know that I can soon give him a big hug, that I can visit with him for longer than just a few minutes, I can sit and watch TV with him or share a meal with him, just laugh with him, that's a great benefit to me. Taking the vaccine, as I think about it, will allow us to be with each other without hesitation. As I think about who God created us to be, we were created to be in relationship. We were created to be connected. God created us to be together. And while we found some pretty creative ways to be together this past year, there is nothing better than a warm embrace. There's nothing better to have shared experiences with each other, whether it's at home with family or work or school or church. I know people who haven't sat in their church pew for a whole year. And so the vaccine will allow us to enjoy the familiar things of life, things that we often take for granted, but not so much anymore. And as I talk about the vaccines with people, so whether they are considering taking it or not, I share with them that I know it's a personal decision, and I respect that. But I also know that our personal decisions don't just impact us, that they impact everyone around us. And so it's obvious there's a tension. But for me, the vaccine allows each one of us to be there for our friends, our family, our community, to celebrate birthdays together, to grieve at funerals together, to dance at weddings together, to cheer on our favorite sports teams together. And we've made enough sacrifices this past year. I think this is an opportunity to reclaim our humanity and to be with each other.
Thank you, Reverend. Let's also call on our community leaders, Dr. Hablitzel and County Commissioner Landis. Would you like to make a couple of short comments about this?
Absolutely, given the opportunity. And again, so many people have suffered so greatly around us. And my mother has been in long-term care since October of 2018. And we had a regular routine where we would go up and visit. Then when the pandemic set in, it was that we could see her for an hour a week outside, socially distanced, wearing a mask. And she has memory issues. She's in memory care now. And she doesn't understand why we can't come in, why we can't hug her. And that has been so difficult. Well, then, she goes to a more restrictive side of the facility. And we're allowed to see her through the window, talking on a phone, and she barely knows how to operate a telephone. And we spend our time, outside in the elements, talking with her, and her question is continual. Why am I here? What has gone on? Why can't you come in? And I think of people that are in that situation in a long-term care, and then I look at my grandchildren, who early in the pandemic we were over at their house, and they came up to me in the driveway and they tried to hug me, and I had to put my arms out and say no. And we ended up sitting in the driveway talking in a circle. We want to get back to normal. We certainly need to do all we can. We got the vaccination. And we're going to do all we can to make sure that we can get back to see my mother in long-term care, and that I can hug every one of my grandchildren.
Dr. Hablitzel?
As a physician, I know that this vaccine has been proven and shown to boost our immune system and enable our body to better fight off this virus and prevent infection. We know that this reduces demand on hospitals and the intensive care units to keep the hospitals open for our community. But, the benefit where to take the vaccine, it's going to help reduce my risk of infection. We also look at community. And in Adams County and in many rural communities, it's community that's one of our greatest assets. And so if enough people take the vaccine, we reduce the spread throughout the community, and we're helping our neighbors. We're helping keep the schools open. We're helping keep the stores open. So we, do this for yourself, and do it for your neighbor, and do it for your family.
Thank you for your comments. Let's move to our next question. What have you been telling people in your community who are concerned about taking this vaccine? I have the pleasure to introduce now Health Commissioner Corey Hamilton. She's with the Zanesville-Muskingum County Health Department. And in addition, we have Senior Deputy Director Lance Himes. He is with the Ohio Department of Health.
Thank you, Wally. Good evening. It's very nice to be with you this evening, and been very nice to listen to the other panelists tonight. Thank you for sharing all of your stories and your wisdom. When I think about vaccination in our community, public health has been practicing for this for over a decade. We didn't really know that it would look like COVID has looked in our community, but we're definitely ready and willing and able to get people vaccinated. But I think it's first important to acknowledge that there is hesitancy on the part of some people about this vaccine, and that's okay. It's okay to have questions. We all come from different levels of understanding about science and health, and all of this pandemic is really new to everyone. But the important thing is to get your questions answered from credible and trusted sources, as some of our panelists have already gone over with you. With vaccination, when more people choose to be vaccinated, it will be safer for all of us to return to some of the social activities and gatherings we all miss. We can get back to doing the things we love. If we work together to keep the virus from having an easy way to spread from person to person, we'll all be better off and get through this pandemic together. Also, as the doctors have mentioned this evening, have already provided a lot of information about the vaccines and the development and the safety and testing of all of it, and the science behind it. And in today's very complex society, it's important for us to look to these experts to help guide our decisions. We simply cannot know all the things that we need to know to keep us healthy and safe. And finally, what I tell people in the community is it's important to look at what we've already seen happen with vaccination during the clinical trials and in the past few months since vaccinations have begun in communities. More people vaccinated means fewer people for this virus to infect. The number of infections is declining, fewer hospitalizations, fewer severe cases with poor outcomes. While we're not in the clear yet, we are seeing very hopeful signs for better days ahead.
Thank you, Corey.
Thank you for tuning in tonight. I would also add to what Commissioner Hamilton said, that from a statewide perspective, the Department of Health, we're striving to provide those facts and that information and those educational materials that people are looking for, because as Commissioner Hamilton said, it is all right and okay to have questions. It's completely normal. So we've assembled on our website, coronavirus.ohio.gov, many resources and facts and scientific materials, but in easy to understand formats. So please visit our website. If you have questions that the website doesn't answer, we have a COVID hotline. It's 1-833-4-ASK-ODH. And you can call our hotline and ask nurses and other staff questions that you may have, and we can point you to answers. That's the most important point, is to gather information to make a decision that's right for you in this vaccine. I would also add that one thing that we've been communicating is since December 14th, when this vaccine first became available, millions of doses have been administered, both in Ohio and nationally, and even globally. Over 78 million doses have been administered in the United States alone. And we're monitoring very closely any issues with safety. And above all, it's been very safe, very few, if any, negative reactions to the vaccine. So the benefit really is outweighing any risk related to this vaccine, which has had clinical trials and other studies and FDA and CDC approvals. So really finding the facts and understanding the risks and the benefits that many of the other panelists have talked about is really important. So thank you for tuning in tonight.
Thank you, Lance. Thank you, Corey. Let's move to Dr. Hablitzel and Commissioner Landis. Could you comment on what you're telling people in your communities?
Doctor, I'll defer to you first this time. Well, I guess, Wally, the question I get on a daily basis is, when are we going to get out of this? And I answer the question with another question. It's not when, it's how are we going to get out of this? And this vaccine is the next next step. And it's a very, very important step in the process of returning to normalcy here in our communities, with our loved ones, with our families. So again, I answer the question with the question is, it's not when, it's how do we do it? And people are looking for the answer, follow the science. And, I try to lead by example by getting the vaccine. And I trust the medical community and what I'm hearing. And again, if people want to, return to normal, this is the step to take.
I think that's good advice. And again, we've heard before this evening, it's okay to have questions. It's okay to be uncertain. A little over a year ago, this virus was unheard of. We've learned a lot in a year. So it's okay to have questions, but trust your medical providers and watch as they step up and take the vaccine. And we need to have faith in our physicians and our medical advisors. And this is the right step.
Thank you, gentlemen, for those comments. Let's move to our next question. Is the vaccine safe? And how is the safety being monitored? What are the potential side effects of the vaccine? And what is in the vaccine? Let's move back to Commissioner Hamilton and Senior Deputy Director Himes.
Thank you, Wally. Yes, the vaccine is safe and it is effective. And how's it being monitored? Maybe in a unknown to many of the population, the CDC and the FDA have some very strong monitoring and surveillance systems in place to monitor vaccines as they're given across the United States, and to monitor any serious side effects that are reported about these vaccines. This is just standard public health practice. Most people don't know that it really happens, but those in the medical community are all a part of these reportings and the monitoring to make sure that this vaccine is safe for you. The potential side effects of the vaccine are generally mild. They can range from a sore arm or a little bit of redness at the injection site to a light fever, chills, feeling a little tired, and maybe just being a little bit achy. In my experience in our local community, the mild side effects impact about 30% of the people who get the vaccine and are more common with the second dose of both the Moderna and the Pfizer vaccine. Most people are telling us that the side effects really only last for about 24 to 36 hours. And they're really easy to get over with normal over-the-counter medicines that they would take for those types of symptoms if they had them other ways.
I would also add, go ahead, Commissioner.
No, I was just turning it over to you.
Thank you. I would also add, in addition to what the Commissioner had mentioned, these vaccines will be the most monitored vaccines in United States history in terms of safety and of efficacy because of the volume and the wide scale distribution of these vaccines. Again, there will be no vaccines that will be as monitored as much as these. The FDA and CDC do have the vaccine adverse event reporting system. It's called VAERS. And if there are adverse issues, those are reported to the FDA, and they have a team of experts and doctors who will assess those. Many times they're not necessarily even related to the vaccine, but somebody may have a health issue near or close in time to taking the vaccine. And this group of scientists and doctors with the FDA will monitor those and assess those and investigate those and take action if needed. In addition, there's also a CDC tool called vSafe, and it's a smartphone app. So after you get the vaccine, you can download this app. It'll remind you about the need for a second dose. but it also has a direct link. If you have any questions or adverse events or side effects that you feel you need to report, you can report it through the smartphone app to the CDC. So again, the monitoring is really at a scale that's never been seen before, and the safety will be ensured. Thank you.
Thank you, Corey and Lance. Let's move to our medical professionals again. Dr. Sherritt and Dr. Anderson, would you like to comment for us, please?
Yeah, Wally, thank you. I'd like to say a couple things. Again, the short answer on the safety of the vaccine, and it's been well explained here so far, is that the answer is yes. The vaccine is extremely safe, and it's amongst the safest vaccines we've ever seen. When we talk about possible reactions to vaccine, I talk to patients and I tell them to understand the difference between the immune response, excuse me, and an adverse reaction. The immune response is the symptoms that have been described, the soreness in the arm, the body aches, low-grade fever, chills. That is not an adverse reaction. That's an immune response. And frankly, that's what we want to see, because that immune response indicates, A, that the vaccine was a high-quality vaccine and that your immune system is intact. And then, you know, in terms of the monitoring, they did a really good job explaining that. You know, I have patients that tell me they're afraid to take the vaccine, and I understand that. I really do. The reality is, from my perspective, I'm more afraid not to take the vaccine than to take it, because what we're looking at is you really have two options. You have an option to either take the vaccine, or you have the option to face the virus, and you're much safer to take the vaccine than face the virus without the vaccine. Patients sometimes have the perception that their condition may be too bad to take the vaccine. The reality is, the more frail someone is, the more they need the vaccine, and the more important it is to be vaccinated.
One thing I'll add really quickly, the different levels that have already been taken to be able to monitor this vaccine. So there's federal entities that are monitoring the vaccine. There are local, state, and federal level public health agencies that are monitoring the vaccine. You as an individual can help monitor the vaccine through the apps and the messaging services that we've already heard about. So individuals, public, private companies that that developed the vaccines in the first place are all contributing to monitoring the safety and the efficacy of this vaccine. Before it's distributed to the public, there are literally hundreds of different health and medical professionals that looked at the preliminary data during the trials to see whether or not the vaccine was going to be safe for public use, and if it was going to be able to combat the virus the way it was supposed to. So it has been vetted before distribution. It is continuously being vetted by private and public entities at all levels, down from you to the individual, to the CDC and the FDA.
Dr. Anderson, can I make one more comment?
Oh, please go ahead.
Yeah, I'm sorry. I just want to make one more comment, because one of the questions is what was in the vaccine, and it's important to know what's in the vaccine, but I think it's equally important to know what's not in the vaccine. At least with the first two vaccines that have come out, there's no mercury in the vaccine. There's no strong preservatives in the vaccine. There's no virus in the vaccine, and certainly no live virus in any of the vaccines. And those are the things that people are concerned about in terms of safety. So really, from a safety perspective on the vaccines, it's just as important to know what's not in the vaccines in terms of preservatives, live virus, and other chemicals that might be a concern to people.
If I can add to that just really quickly, the only component from the virus that is in the vaccine is a very small snippet. Something that's on its own isn't able to infect anybody. Its only job is to produce a molecule that your immune system is able to see, recognize, and then fight when it sees the real virus.
Thank you, doctors. Let's move to our next question. Who is eligible to receive the vaccine right now? And how will I know when I'm eligible to receive the vaccine? Let's move back to Health Commissioner Hamilton and Senior Deputy Director Himes.
It's a growing group of Ohioans that are eligible to receive the vaccine right now. Today, the age group 65 and over are eligible to receive the vaccine. Also, healthcare workers, emergency medical technicians, those working directly with individuals who have COVID in the hospitals or in nursing homes. The long-term care facility residents and staff are eligible to receive vaccinations, and community members with conditions that put them at greater risk for complications if they get COVID-19. The list is really very long. And as of Thursday, that list will grow more. Those 60 and over will be eligible to receive vaccinations. Child care providers, those who work in daycare centers, will be eligible, along with those who provide funeral services in our community. And in addition, our law enforcement and corrections officers and our firefighters. And there's several groups that within those categories that I've mentioned, it's very, very specific. And all of that information about who is eligible can be found at the coronavirus.ohio.gov website, and is likely also listed on your local health department's website. So listen to your local media sources, read your newspaper, and reach out to your health department to find out where you can get a vaccination and when you'll be eligible.
Lance?
The only thing I would add to that, a very comprehensive answer, is that you can certainly also call the ODH coronavirus hotline, and we have the current eligibility information at the ready. That's 1-833-4-ASK-ODH, and people would be happy to tell you what the current eligibility is. Thank you.
Thank you for your comments. Let's move to Dr. Hablitzel. Doctor, did you want to make any comments about eligibility and when people would know?
Well, the big news that was just came out today is that the eligibility is expanding coming Thursday, where the excuse me, the age would drop down to 60, and we're going to be able to cover more groups such as the law enforcement, fire, and so the availability is different as far as how you get scheduled for the vaccine. And I would urge everyone to really look at your local health department website. There's usually a wealth of information there about when you are eligible, how you register. So I agree with Commissioner Hamilton that that's a wonderful resource.
Thank you, Doctor, for your comments. Let's move to our next question. What does your faith say about taking care of your body and your family? Let's move back to the Reverend Steele. Reverend Steele?
Thank you for that question. Our faith has a lot to say about taking care of ourselves and our families and each other. In the Christian faith, we hold to the belief that we are created in the image of God. So each person has great value and worth and is full of purpose and possibility. In the New Testament, in the book of John 10:10, it's one of my favorite Bible passages. Jesus says that he came that we would have life and life abundant, not just eternal life, but in the here and now. And I don't know about you and those visiting with us tonight, but I don't think that we've been living our most abundant life lately. People are tired and stressed and sad and lonely and maybe just feeling stuck. That is not the life that God desires for us. I'm a firm believer that God has already given us everything we need to live the abundant life. Our communities are rich in resources and people, history and culture, and we have an exciting future to share together. In the time we find ourselves in now, 1 year dealing with COVID-19, I believe that God has given us everything we need to end the suffering of so many people. God has given us people with knowledge and skills to treat the virus and technology to create a safe and effective tool like the vaccine to fight the virus. Why do we have to deal with the virus? I don't know. But what I do know is that with God's help and people using their gifts and skills from all sectors of the community, we can get back to living that abundant life. Yes, it requires trust, but everything in life is founded on trust. The social fabric of our communities is dependent on trust. For me, I trust that God is at work, and I also believe, I trust in healthcare and the good that it can provide for so many people as well.
Thank you, Reverend, for those comments. Let's move to our next question. Does the vaccine cost money? Always a big question with folks. Let's bring back our community leaders, Dr. Hablitzel and County Commissioner Landis. Commissioner Landis, let's start with you this time.
Well, thank you, Wally. And again, thank you for letting me be part of this. And, you know, people are concerned about cost. And the fact of the matter is that no individual is going to be charged to get the vaccine. Nobody is going to have to pay, to give money, to be billed at a later date. And people may say, well, how can you do that? Well, the cost of not paying for this, you know, by the government not paying for it, certainly it would be a greater cost of treating people if they don't get the vaccine or if they're limited and they couldn't afford it. So that's why it's being offered, you know, free of charge to the individuals. They're not going to see this. You know, we're encouraging them to get out and get the vaccine. There's no financial, you know, duties there, and I think that is a big driver in the community. Is we can vaccinate people of all creeds and economic you know, situations. So it's a blessing that we have the ability to put out a program like this at no cost to the public. So thank you.
Dr.
I agree. There's our tax dollars, the federal government is buying this vaccine, so there's no direct cost to anyone to receive it. There's enough barriers in what we need to do in daily life. That won't be one of them. There are some vaccine providers, when you go for your vaccine, some vaccine providers will bill insurance carriers to help defray the cost of the administration of the vaccine. So if you're asked for an insurance card or information like that, that's not, you will not receive a bill. Your insurance company often will help contribute to pay for the cost of the staff and all of the expenses that go into administering the vaccine, but no one will pay anything out of pocket for this vaccine.
Thank you, Doctor. Let's move to Commissioner Hamilton and Senior Deputy Director Himes. Same question about the cost.
I know in my community, most of the vaccine providers have agreed to work together to make sure that we can vaccinate as many people in our community as we possibly have doses to accommodate, and that there will not be a charge. That's all being taken care of by the federal government, and we are very appreciative of not having to charge insurances or to bill for those services, as that is quite time consuming.
I would just add that, so the federal government, as Dr. Hablitzel said, has provided these vaccines to all of the states for distribution. And when we enroll vaccine providers in our state to give the shots, as part of our agreement, they know that they cannot charge for the vaccine itself. They can seek reimbursement for the administration, and that's the cost of the nurse or the doctor putting the shot into your arm. But as we've stressed with them, there is no out-of-pocket cost for individuals who get the shot. So certainly it's covered by Medicaid, private insurance. There's also federal funding available, but you will not, as an individual, be charged for the cost of administration of the shot. So really the barriers have been removed, and we stress that with our providers, with the pharmacies, the hospitals, the health departments, the federally qualified health centers or clinics in your area. They know that there are limitations on what can be charged and no out of pocket for you.
Thank you for those comments. Let's move to our next question. This is the final question of the evening. What identification documentation do I need to get a vaccine? What kind of paperwork? A license, a piece of mail? We're going to go back to Commissioner Hamilton and Senior Deputy Director Hines.
I know in our rural communities, it's probably more likely that a lot of people know a lot of people. So you may know exactly who you're dealing with when you drive through that vaccination clinic or walk in that vaccination clinic site. But we do want to verify that you are at least over the age appropriate for the vaccines that we're providing. So we would like to be able to identify or to verify your identity, your name, and your age. And a variety of different documents can meet that purpose. A lot of people are using driver's licenses or some other verification source. In our school programs, all of the school related folks had their school ID, and that made it very easy to identify them as a school personnel and be able to know that they were eligible to receive the vaccination that they received.
I would just add to what Commissioner Hamilton said. Certainly, there's a wide variety of ID that is acceptable, and again, it's only to verify, your identity and your age and your likeness that you are you. We have a list on our website in the FAQ section on our coronavirus.ohio.gov of acceptable IDs, and also it can be an expired ID. And that's important because we know that many people have not been able to get back into the Bureau of Motor Vehicles to renew their license potentially because of COVID. And so there are a wide variety of IDs that are acceptable. Again, just to show your age, for the Pfizer vaccine, you need to be 16 and older. For Moderna and the Johnson & Johnson vaccine, you need to be 18 or older. And that's part of the reason for that age verification is for the vaccine safety. So really just check out our website and you can see which forms of ID are accepted when you go to get your vaccine.
Thank you for your comments. We've done very well with time this evening. So we're going to do some round robin here, and we're going to ask all of our moderators one by one to maybe give us a couple of thoughts that you have about the evening or something that you want to emphasize. So Dr. Sherritt, let's start with you, sir.
Thank you, Wally. First of all, thank you for including me in this discussion tonight. It has been a privilege and an honor to participate. When I talk to patients each and every day about the situation we're in, there's a lot of comparisons that can be made to the situation we were in many years ago with polio virus. And the polio virus was just a devastating situation at the time. And we fortunately were able to develop a vaccine that was able to conquer the polio virus. When I ask patients now, when's the last time they worried about getting polio, they kind of look at me with a puzzled look and say, well, I really don't worry about polio. Well, the reason we don't worry about polio today is because we have an effective virus that we've all been vaccinated against that virus. We're in the same situation with the COVID virus, and we're just now starting to see the benefits of vaccination. Now, certainly you should go into this with your eyes wide open, but the Lord has blessed us with an opportunity to overcome this, and we have an effective virus, and or an effective vaccine rather. So, I encourage everyone to do your homework, listen to your trusted healthcare professionals, but get the vaccine, because that is our only tool to overcome this. And together with the vaccine, I believe just as the polio virus was conquered, this virus will be conquered, and we'll be able to move forward to brighter days.
Thank you, Doctor. Dr. Anderson.
I also appreciate the opportunity to get a chance to talk a little bit about this tonight. I've been working to help oversee at the federal level the production of this vaccine and make sure it's safe since about August or September. So seeing us getting to the point where we can start doing things like I haven't been back in my church since last March to be able to go back to that building and be able to begin moving forward is something I'm really looking forward to.
Thank you, Doctor. Let's move to our faith-based Reverend Steele.
Thank you. It has been a pleasure to be with everyone tonight, and a lot of questions have been answered. I would just encourage the listeners that if you have any other questions, there's no bad questions. So please reach out to a trusted source that you might have. And if you have been vaccinated, if you have been able to receive the vaccine already, perhaps this might be an opportunity to reach out to a friend or a neighbor or a family member. And if they're having a hard time finding a location or getting information, that you can be their source, that you can help them schedule an appointment, that you can help take them to get their vaccine, and that you can be an advocate as well in your community.
Thank you, Reverend. Let's move to our community panelists, Dr. Hablitzel and Commissioner Landis. Commissioner, would you start first, please?
Yeah, thanks again for the opportunity. And I hope those that tuned into the town hall this evening found it very informative. You know, it's information that's coming direct from the experts. And, you know, I'll be glad to share my story of why I got the vaccine, and I will share my experience as to the results of it. And again, I encourage you to reach out to your primary care providers and ask them the questions that you need to have answered. And again, I just encourage you to take this information, and if you're able to get the vaccine, I encourage you to do it. Thank you.
Dr. Hablitzel.
It's been a pleasure to be here tonight, and I appreciate the opportunity. I think all said and done, this is an opportunity that we can take to reduce our risk of infection and sometimes become profoundly ill. But maybe more importantly, it's also an opportunity to do something to reduce risk for our family, our neighbors, and our community. And I think as a community, we work together, and there's light at the end of the tunnel.
Thank you, gentlemen, for your comments. Last but not least, let's move to Commissioner Hamilton and Senior Deputy Director Himes.
Thank you for being with us tonight. I hope that you found this informative. I want you to know that in Ohio, we're all working together to vaccinate Ohioans. Please feel free to get your vaccination where it's most convenient for you. Reach out within your community to a pharmacy or your hospital or your health department to identify where those vaccinations are happening. Know that many communities have several options available, so individuals can walk into a community vaccination site or can drive through one if it's easier for you to do that. But whatever you choose, make your decision carefully, get your questions answered, and get vaccinated.
I would just add that certainly if you can visit a website to find the vaccine, you could go to vaccine.coronavirus.ohio.gov. But for those of you who may not be technically savvy or may have internet access issues, you can also pick up the phone. Certainly the 1-833-4-ASK-ODH line can be helpful in locating vaccines, but also locally you may be able to dial 211 or your local health department or your area agency on aging, and they can assist you with finding vaccine availability and possibly setting up an appointment for you also. So we have over 1,200 providers currently in Ohio, in all 88 counties. So we think that there'll be a source close to you that's convenient for you, and we'd encourage you to get the vaccine when it's right for you. So thank you for tuning in tonight.
Thank you for your comments. Unfortunately, we are to the end of our hour. I have several thanks to do before we end. Many thanks to Governor DeWine, our medical team, Dr. Kevin Sherritt and Dr. Matt Anderson. I'd also like to thank our community team, Dr. Bill Hablitzel, County Commissioner Al Landis. We'd like to thank Reverend Ashley Steele, Health Commissioner Corey Hamilton, and Senior Deputy Director Lance Himes. We'd also like to thank our sponsors, CAS, the Ohio Department of Health, the Ohio Department of Mental Health and Addiction Services, the Governor's Office of Faith-Based and Community Initiatives, the Ohio Latino Affairs Commission, the Appalachia, Ohio Commission, and last but not least, our friends at Live Productions for today's town hall. I'd also like to remind you of the phone number to get information. It's 1-833-4-ASK-ODH. Many thanks to our viewers for attending our Ohio Rural Town Hall. We appreciate you. This concludes our Town Hall series. This Town Hall will be re-aired on Saturday, March 6th at 7 p.m. and Sunday, March 7th at 3 p.m. on the Ohio channel. The entire Town Hall series can be watched on demand at coronavirus.ohio.gov. Once again, thanks to our moderators and our sponsors for their time and to you for joining us. Have a great evening.